Meanwhile, at the climate change conference, a further 18 countries have agreed to a plan to stop using coal power plants. It brings the total number of countries backing the plan to 40, but some of the world's largest coal users, including China and the US, have not signed up. Coal is the single biggest contributor to climate change. Well, Dr. Jeni Miller is Executive Director at the Global Climate and Health Alliance, and she joins us now. It's pretty clear, isn't it, about the impact that climate change is having on people's health around the world. What is the most serious issue, do you think, that we're facing at the moment? Is it air pollution, or is it what climate change is doing to people's habitats and migration and being caught up in wildfires and flooding?
Yeah, I mean, these are all really significant impacts. It's hard to say that one is worse than the other. Clearly, the air pollution issue is a major impact. And this is driven by the burning of fossil fuels that drives climate change and is a major source of air pollution. Air pollution kills over 7 million people a year. So addressing climate change by phasing out fossil fuels and moving away from coal is a fantastic first step. That would have yield significant improvements for people's health right away. But these other impacts, they're increasing. We're seeing a heat wave in Canada this year killed hundreds of people. We saw 80% of the population of Australia exposed to smoke from wildfires in Greece and Turkey. Flooding has been seen around the world. 17 people died in a hospital flood in Mexico this year. So all of these impacts are significant and unfortunately growing as the Earth warms.
Just focusing on air pollution then, I mean, can this be turned around quite quickly? When you think of major sporting events, Olympics and things like that, when cars are banned, you see quite a sharp uptick, don't you, relatively quickly in people's health?
Yeah, that's absolutely right. If we phase out burning coal, burning fossil fuels, reduce emissions from or eliminate emissions from transportation, the air quality improvements happen very quickly, and the health benefits come right behind that very quickly. So countries who take these actions will see those benefits in their own country, in their own populations, quite quickly indeed.
What about hunger? We talk about flooding and people being forced out of their homes, but what about crop declines as well through soaring temperatures and science not really being able to keep up with that?
Yeah, unfortunately, climate change has driven exacerbated significant droughts in several countries across Africa. And this has really driven a number of communities kind of to the brink of famine. There are concerns that have been raised by some of the climate research that we could see multiple crop failures in multiple kind of breadbasket areas of the world concurrently if we keep on the path that we're on. So it really is a fairly dire scenario that we're facing if we don't tackle this issue. But on the flip side, if we do, there are real opportunities to improve health through the actions that we need to take for climate change.
That's the physical health aspects. What about the mental health aspects? I mean, not only in the developing world, but in the developed world as well, especially perhaps with younger people, children and young adults worried about their future.
Yeah, absolutely. This has really been an emerging issue that's kind of been coming up and been more on the radar, actually, of the health community for the last several years as more and more people really dial in the risk and the threat of climate change. People are worried, they're concerned, it's affecting their mental health. On top of that, people who experience some of the traumatic events like extreme storms and heat waves and wildfires and so forth can end up with PTSD, so lingering mental health effects from the trauma of those experiences. And of course, anybody who is forced to migrate from their home really is extremely vulnerable to mental health issues as well as a number of others.
Dr. Jeni Miller at Glasgow COP26. Thank you.